Hi, I've been asked to give an update by Lenya and Rita on the activities of the task force. So I've got some slides to walk through, but I will keep it short. So in terms of the guideline task force, are more active this year. They set last year a number of webinars which they wanted to prioritize to be developed to share. So we've been doing those guidelines webinars, and we've got some more coming up. We haven't yet sort of switched on the peer learning aspect of the task force. It's been more setting the agenda on what topics we should look at in terms of webinars. We've got 17 people in the guideline task force, so not 11 ERNs are currently represented. One of the results of one of the earlier webinars which we did was to develop a guide for patient involvement in the development of clinical practice guidelines and clinical decision support tools. So this guide is available. It was published in June, and it goes through the very simple steps of where is it best practice and where is there added value for patients to contribute in that process of developing a guideline. So Lenya was the one who led this piece of work, and I think it's a good outcome. We completed a number of webinars last year, and at the beginning of this year we did a webinar on how to develop plain language summaries. This year we've got another webinar planned on how the roadmap for what's the roadmap to implementing new guidelines, what does that look like. We have the consortium who developed the methodologies for the networks confirmed to take part in that webinar, and we've got 2 ERNs. We've got one European Federation involved in that, and we're just securing an ERN representative to present how the ERNs lead on implementation of existing guidelines which have been approved by the network. So we want to get that ERN perspective, but also from a patient organisation, how can we learn from existing mature patient communities who lead on implementation. So that webinar we had penciled in for October, but we're still trying to secure the date for the for an ERN representative to share how the ERNs implement guidelines. We have a webinar which is penciled in for the end of November on the appraisal of existing guidelines. How do we do that? How do ERNs do that? We've got 2 ERNs represented in that webinar, and also support again by the consortium, the guideline consortium. We are going to probably do an eighth webinar on how we take an existing guideline and adapt it. The appraisal of an existing one is adoption straight away. There's no change. So we thought about separating out appraisal and adaptation into 2 separate webinars because it gets confusing otherwise. And we've been working with the consortium, the Commission's consortium on the guidelines, and they're going to develop a new handbook number 13, on patient involvement in guidelines based on the evidence they have found. It sort of is in there in all 12 handbooks, but they're pulling it together into one. The difference between this handbook 13, and our patient guide is that ours is aimed at the patient community, and theirs is aimed at the clinicians. We thought that that was a good marriage of the 2, and we will ensure that the methodologies are aligned. So it should give greater support and guidance to the clinicians on where to involve patients, and we're advising the patients where it's added value. So hopefully that will give added value. And then a webinar which we'll plan probably for next year is around, for rare diseases, there's a low evidence base out there, so using grade is really difficult. You end up with poor evidence. It's graded as low in terms of strength of evidence, and so you have weak recommendations, and that's because of the small size of population, you'll never have big volume research and studies. So there is a modified grade approach. So it still is robust, but it recognizes that a smaller patient cohort would have a smaller amount of evidence. So it recognizes that, and it tries to be quite pragmatic about how to deal with it. So we're looking to do that webinar next year. So for AMEQUIS, the AMEQUIS working group, we've been quite active. So you all know that AMEQUIS stands for Assessment, Monitoring and Evaluation, brought together into a quality improvement system. The first objectives of the group was to work last year, and we were very active because the AMEQUIS framework was being developed by a tender, a consortium. So we have these are the representatives from the ePAG Task Force. They've been very active. So, and what we've done, we've got 15 members. We've still got gaps. 11 ERNs are covered. So if you know for other representatives in ERNs, your ERNs, which you could identify and can fill in the gaps, that would be wonderful. You can see here lots of activity we've done over the last 12 months, 18 months now. But we started the year after giving advice on the AMEQUIS proposal back in November, December. We've done a workshop in February where we debriefed and we reviewed the impact of our advocacy on the development of the AMEQUIS framework. We did another workshop in April where we looked at the evaluation manual, because this year we move into evaluation of the networks, and we then did a webinar called Demystifying AMEQUIS. We did another webinar in September, so this one in April looked at the evaluation manual, and the workshop we did in September looked at the evaluation criteria. So what are the standards the networks and the HCP members will be evaluated against? So we've consolidated all that now, and we've developed a patient guide and a Q&A fact sheet. And we have a webinar, which is tomorrow, on the patient involvement in the evaluation of the ERNs. So these were the advocacy which we did on the assessment, monitoring, evaluation, and the AMEQUIS proposals. If you're interested in that, we can share that with you. This is the evaluation manual and toolkit, which the networks will be used and the independent evaluation body will use. And actually together it comes to nearly 200 pages. So no one in their right mind will read that, but we did. And we digested it and we turned it into a technical guide for patients, patient representatives of the evaluation of the ERNs at 5 years. So we reduced that 200 pages down to actually 9 pages with an appendix. So anyone who is formally part of the evaluation process in the ERNs, we recommend that you read this, and this will be available after tomorrow's webinar. And for all the patient representatives involved in the ERNs, we thought we'd do a 2-page fact sheet which says why, what, who, when, how, those key questions around the evaluation, and to understand the patient role. So this is very clear as a layperson's version, something which is very easy and digestible for everyone. But for the people involved in the actual evaluation, some patient representatives should read the more technical one. And that's it. So hopefully some of you will be joining the webinar tomorrow, and this next phase in the evaluation of the networks is really important, and we should see the evaluation start in the next month. So it is a time to engage together. It will be great to engage with your patient representatives in your network. So please link in with Lenya and Rita to organise where we could have more of a one-to-one group discussion per network to show where patient representatives will be involved, and to start thinking about some of the questions which patient representatives will be asked. Thanks.